Hello, I'm Dr. Heemstra of Ketamine SLC, and I'm going to talk now about dosing of ketamine. That'll involve two general dosing schemes. One is the protocol one that is conventionally utilized for ketamine that was established 10 to 15 years ago. And the other will be my variation on it, where I tweak that to condense it down to one dose so that I can cut the price of my ketamine by 1/6. So in the beginning, when we were making the decisions about dosing on ketamine, the single biggest factor was the doctor's concern for adverse emergence reactions. The patients could have them, and they could be unpleasant, and that alone upset the doctor. But more than that, an emergence reaction could result in a patient's active activity where they could be roaming around, falling, or otherwise hurting themselves in a confused state. So to deal with that is to minimize it, the original dose of ketamine was determined to be 0.5 milligrams per kilogram given IV over 40 minutes. Now, that dose works and has been chosen to, as I said, minimize those emergence reactions. And at that dose, there really are very few of them. In 1,200 patients where I've started off with that dose, I've only had 2 that had negative emergence reactions, so it works pretty well. So looking at that 0.5 milligrams per kilogram, which will evolve into a schedule where that amount is given once every 48 hours for 6 doses, and then that series of 6 repeated every 3 months. How did we get to that dosage? It is an interesting pathway. If we give one dosage of that amount, either intramuscular or IV, we will get 10 to 12 days of freedom from depression. And that's a special freedom with ketamine, because ketamine's half-life of 20 minutes means that the drug itself comes into the brain, influences the brain, changes it, and then is gone. So that most of that 10 to 12 days of freedom from depression is also with no drug levels and consequently with very, very few side effects. Now, if we give 2 doses of that 0.5, we get 3 weeks of depression relief. 4 doses, we get 6 weeks. And with 6 doses, we get a full 12 weeks. That's 3 months with no depression, no drug level, and no side effects. And that's the standard protocol dose. For instance, our local university uses that dose and will not go beyond it, primarily for fear of the emergence reactions which can happen at higher doses. Now, I'm the cheapest ketamine in America for 2 reasons. One is my $200 per treatment dose. That's as cheap as it gets right now, as far as I know. But I'm much, much cheaper because of the fact that I can take those 6 doses that are given in the normal protocol doses and I condense them down to 1 dose. So that my goal is to eventually have you accept for your ketamine treatment 1 dose of ketamine every 3 months for $200 forever. Deal of the century, which is an example of basically how you would treat an epidemic, which we have ongoing. I see it and mention it as a polio epidemic, not because it's polio, just because that's the model that I'd like to take. We do want to be able to administer ketamine cheaply to 80 million people. And that can be done if we keep the price low. So how do I do that? How do I get to that one dose from those 6? What I do is use those 6 doses, but only once. After this usage, it'll only be 1 dose every 3 months. So I start off by administering 2 injections for each treatment session for the first 5. And with each injection, we increase the dose by 10 milligrams. So that on the first day, if your protocol dose of ketamine was calculated to be 40 milligrams, I would be gentle and drop that dosage down to 35 milligrams and give you a dose of 35 milligrams initially, and then a half an hour later, when you'd reached the end of that medicine cycle, I would give you another dose of 45 milligrams. And then I would let you go. And in 2 days, when you came back and your brain had acclimated to the ketamine, I'd give you 55 and 65. On the 3rd day, it'd be 75 and 85. And we'd keep crawling up until on the 5th treatment session, the largest dose would be 120 milligrams. From that 120 milligrams, which is 3 times the initial dose of 40 milligrams, I would construct what I call a booster made up of 3 injections of that 120 milligrams. Now that 120 milligrams, or that 360 milligrams, is more than 6 times the protocol 40 milligrams of 240, which means that you have enough ketamine to last for the whole 3 months. So on that 6th visit, I'll give you that 360 milligram dose and let you go. And if you last 3 months without depression, then we don't have to do any more calculating. I'll give you that 3-leg dose for $200 every 3 months forever. Deal of the century. And that's how you treat an epidemic of 80 million people being sick.